Hi everyone, I am Dr. Sumant Kumar Raut. So today our topic of discussion is to clear the different doubts and myths about bedwetting in children. Most of us already know about the fact due to different forums of either some parents or the relatives or the neighbors or maybe the WhatsApp groups of parents with luckily affected children may have already discussed this fact repeatedly. Why I am telling it luckily? Because as I already told, there are some myths and taboo regarding this nocturnal nighttime bedwetting also. Because many a time children as well as the parents may not try to reveal the problem to other of their seniors or to the doctors, and which is not actually good, because for that reason we may land up in a late diagnosis of some bad outcomes, and that can lead to further more trauma of the patient's profile. So on nutshell, it's not a rare disease actually. It's around 10 to 15% common in the age group of 5 years in Indian subcontinent like this. And as your child becomes older, that becomes a little bit less, around 5 to 7% for a 10 years child. And for rare child who pass on to adolescent or adulthood, they can still have the disease but in a rare entity. So why this happen actually? There are maybe ways. Some childs are excessively sleepy, so they cannot wake up at the night and they just wet their bed. And many a childs have some inherited problem of their nighttime high urine output due to their hormonal disbalance of ADH. Many a child may have some small capacity of their functional bladder, so that's why they need to pee every 2 to 3 hours at the night time also. And due to inability of their waking up at the bedtime, they pass their urine in the bed. So anyhow, we many of the time parents ask us that this condition is treatable or not, or their child needs a treatment at all. So we pediatric nephrologists, what we suggest that by some minimum clinical examination, just like a simple blood pressure check or some checking of the spine or back of your child, or maybe the checking of the private areas, and doing some other clinical test, we suggest some of the basic investigations like a routine urine test, some routine test for blood, for renal function, a simple ultrasound of kidneys. And the most important test is not done in laboratory but at home by the mom itself, that is the voiding diary. This is a classical example of voiding diary, where we just note down how much ml of urine your child is passing in his void and how much amount of voiding your child is doing in a day over a period of 5 to 7 days. And these voiding diaries are usually freely available in many websites in various languages also. So after this whole workup, we usually decide that your child is having some abnormalities only the primary bedtime wetting, or your child has underlying other defects also, just like your child may have a daytime pant wetting also, or your child may have difficulty in passing urine, the urine stream is not that good, your child has severe constipations. And that is actually the main reason of this bedwetting nowadays, because in current scenarios for urban areas, mostly for nuclear families, both parents were working in the morning rush hour, when they are in a rush to go to their office or something, they hardly have some time to make the child sit properly for a morning urine or a morning potty time. And it's difficult to believe that the maid kept for their care as a caretaker will hardly spare some time to make their child's bowel habit properly, to sit in the potty twice a day in a proper manner, probably for a more than 3 years child in a good western toilet with a stool in below their feet, or for a lower age group child in a good potty seat like a toy seats like this. For this, different from the normal physiology, we usually land up in this high incidence of problem. And so as this is, we can understand this is a behavioral problem, so our investigations and treatment particularly aims at this one also. So first we need to know that our child needs a treatment at all or not, because many a time when the child is ashamed of the problem or the parents are quite concerned, then only we need to start any type of treatment, because some of the treatments are of longer duration, for 6 months or 12 months duration, maybe more. And many a time it's not done properly, not inherent to the treatment therapy properly, there is a high rate of treatment failure. So first of all, we start with some simple guidelines of behavioral measurement, like increase amount of fluid intake per se, but in the daytime. From the evening time, less amount of fluid intake, a big zero to Coca-Colas and cold drinks and tea like this. Maybe some good stool habits that I have already described just now. And maybe it's if better feasible if the mom or dad can give a nighttime alarm of 2 a.m. or 3 a.m. wake up the child once to pass her pee once, and just to see over a month or period that how it is working. But remember, if your child pees at bed, the child has to change the bed sheet by himself or herself. Parents are not going to help anyway. This is the one of the modalities of treatment of this pattern. And even if your child passes wets your bed, please don't scold it. This is a big zero to scolding. It will aggravate the disease and not pacify. Better on the reverse, if your child have a dry day 1 or 2 days, just try to give him some award like some chocolates or Cadbury's for as a matter of reward. So it will act as a good positive reinforcement. And coming to the other direct treatment per se, if your behavior therapy does not work well by 4 or 5 months and still your child or the parents need treatment by urge, so that time we can either propose, as per the Whiting diary and other investigation, we can either propose a alarm system, bed alarm system. Many times we propose some oral tablets for, as I told, 6 months to 12 months of therapy. And after that, most of the child luckily comes out of the disease per se, if they don't have other problems like the urinary stream problems or other thing which I have just told earlier. And most of the time, this type of children don't have a long-term kidney damage in future follow-ups. So that's all for today. And after this also, if you have some doubts regarding this nocturnal and nighttime bedwetting, or if your child is facing such problem, you can always contact us in our pediatric nephrology clinic at Bhagirathi Hospital. Thank you.